Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
It's Lindsay Smith-Rogers, and today it's a book club podcast. Dr. Tom Frieden is the former director of the Centers for Disease Control and Prevention and former health commissioner of New York City. He speaks to Dr. Josh Sharfstein about his new book, The Formula for Better Health: How to Save Millions of Lives, Including Your Own. Let's listen.
Dr. Tom Frieden, it is great to see you here on Public Health on Call. How are you doing today?
Josh, it is great to talk with you. I'm looking forward to this conversation. I'm so excited for the opportunity to share what 40 years of work and 10 years of writing may provide for others.
Well, I have just finished your fantastic book, The Formula for Better Health: How to Save Millions of Lives, Including Your Own. 10 years of writing. What did you want to accomplish with this book?
What I hope to do is to show why public health is important and how to succeed, not just community-wide, but also for individuals. And what I came to after thinking hard about it is that there really is an approach, a formula that has saved millions of lives and can save millions of lives more, including yours.
Well, I'm interested in that. I'm sure our listeners are too. Let me start with your big picture about public health. Why is public health important in 2025?
Public health is our organized actions that allow us to live longer, healthier lives without having to worry about getting sick or disabled or not being able to do the things that we want to do.
Public health is about living the lives that we want to live.
Absolutely. And unfortunately, as I say in the book, in New York City coffee shops, there's something called a double no fun. A double no fun is a decaffeinated coffee with non-nutritive sugar sweetener, a saccharin-like product. And public health has been thought of as the double no fun, but it's really not. If public health has to say, hey, do this or do that, it's because we have failed as a society to make the default choice the easier choice for people.
And if it's $10, is that a triple no fun?
Well, that's a problem. And one of the things that is clear as I did research for this book is that there's so much grifting, there's so much profit making in the healthcare industry, the wellness industry. I'm not selling anything in this book. And in fact, all of the proceeds will go to organizations that resolve to save lives, supports around the world to prevent epidemics and prevent cardiovascular disease. But if you really cut through the hype, cut through the sloppy thinking, there really are a few things that make a really big difference in this see, believe, create formula of saving lives.
So you've just spilled the three key words that are part of the formula, which is in the title of your book here: see, believe, create. Let's bring them to life for people who are listening. When you say see as the first step for saving millions of lives, including your own, what do you mean?
I think public health has a superpower. And that superpower is to see the invisible. We think of this sometimes as surveillance, which is a really scary term. In public health, we understand it as monitoring. But it's not just disease surveillance. It's not just microbes, microbial trends, toxins, population-wide trends. These are all core surveillance things, and they're really important for surveillance. But it's also programmatic changes. Whether we see if we have a well-meaning program, is it succeeding or failing? Because only if we know that can we make mid-course corrections and make it better. One of the things that I had fun doing in writing this book was reading John Graunt's treatise. It's from 360 years ago. He was a cloth merchant. And as far as I can tell, and Josh, you or others may know better, but as far as I can tell, it's actually the first epidemiologic study in human history. It was births, deaths, and diseases. And he found so many things. He saw an emerging disease, rickets, which spread because of changes in the society. He saw that the best way to consider how healthy a society is, the proportion of people who die over age 70. It's a great number. Sir Richard Peto came up with this idea that deaths under 70 are largely preventable, although many deaths over 70 are not. But that's a 360-year-old concept. In John Grant's day, only 7% of people lived to 70. Today in the U.S., it's 70%. But in the healthiest countries, it's 80%. And ideally, it'd be 100%.
Right. So in the book, you give some examples of how public health can see the future. You talked about COVID and the early spread of COVID. Could you explain?
One thing that from my experience, my direct experience running CDC was really dramatic was a model that showed during the Ebola epidemic that the disease was doubling every 3 weeks. And unless we did something, there would be 1 million deaths by the next year. And that kind of hockey stick graph ended up galvanizing action at the White House, at the United Nations, within countries. So simply making the invisible visible was transformative. One of the things that I also learned in writing this book, initially I was going to call it How to Break the Cassandra Curse.
Right.
And then it became clear that a lot of people don't know what the Cassandra Curse is, so that wouldn't be a very good title. But Cassandra, as you know, was a mythological priestess from ancient Greece who was blessed with the ability to see the future, but cursed because nobody believed her predictions and so didn't prevent the tragedies that she could foresee. And I began thinking deeply about why. Why is it that we have this curse? Because public health has had our own Cassandra curse. I can tell you, Josh, with absolute certainty, 1 billion people will die from tobacco use in the world this century unless we take urgent action. And yet we haven't been able to change that. But I think now we can change it because we have new technologies. We have new examples of progress. And we also have new ways of understanding why we have this curse. And ultimately, this curse exists because our perceptions are wrong. Our perceptions of ourselves, our world, and the future.
So that gets you to step 2 of the formula, believe. So you've got the data, you can see what works and what isn't going to work, and you're calling on people to recognize that progress is possible. Could you talk a little bit about this step 2?
It is really important. It's not enough to see the problems and see the way forward, though that's hard, but to believe that it's not inevitable. We have a normalcy bias. We believe that things always have been the way they are now. In fact, the first step in strengthening the belief in possibility is to recognize the progress that's been made. And of course, there are plenty of problems now, and there are some things that are getting worse now. But in fact, people are living longer. We have better technologies. Many diseases are decreasing or have decreased. That seeing past progress is really important. Hans Rosling, in his wonderful book, Factfulness, points out that we have a hard time keeping 2 ideas in our heads at the same time, that things are better but still bad. Bad but better. Because I think sometimes in public health we feel, if we admit things are better, people are going to take their foot off the accelerator and relax. But actually, showing that there's been progress tells you there's no excuse not to make more progress, not things are okay now.
I was going to say, do you feel that when people aren't able to acknowledge progress or the possibility of progress, it may breed some cynicism and eventually make people feel like, well, why even try?
Absolutely. I tell the story in the book of Bill Foege, who led smallpox eradication activities globally. And someone came to visit him in India, and they saw him doing a little bit of everything. And I said, what's your job description here? And he said, resident con man. My job is to keep people believing we can do this. And in fact, optimism can be a self-fulfilling prophecy. It can be misguided. We have to make sure that we're being optimistic based on that good technical rigor of seeing the pathway forward. And he wasn't conning people. He was getting people to work together so that ultimately in the smallpox eradication program, they had 200,000 healthcare workers in more than 70 countries finding more than 10 million contacts and vaccinating them. And it took that kind of optimism to make that possible.
and eventually wiping smallpox off the face of the earth. What you're saying reminds me of a story that I use in my classes, which is after the Parkland shooting, the local representative who supported common sense measures on guns was quoted saying the worst part of this massacre, something like this, one of the worst parts of this massacre is that we already know nothing will change. That was a very cynical view. You could understand why he had that view because efforts at changing gun laws had failed in Florida, but that's not actually how it happened. And it was the young people who said, it doesn't have to be this way. And Florida wound up passing some very important legislation that's protected a lot of people since then.
I think this is important. Part of maintaining optimism is having patience, even as we're really impatient. I'm an impatient person. But if you look at something like drunk driving, it took the advocates decades to change the culture and change the laws. But once that was done, that win is not reversible.
Let's move to the third part of the formula, create. Talk to me about what you hope to inspire in writing this book, calling on people to be creative in how to approach public health challenges.
This is the hardest part. It's hard enough to see things that are invisible and believe things that seem impossible. But then it comes to creating a healthier future. And I really broke it down into 4 different areas. The first is getting organized. And I give the example of emergency response and incident management systems, for example, during the Ebola epidemic, where actually the scariest moment of my 8 years as CDC director was when Ebola hit Lagos, Nigeria. Lagos has a larger population than the 3 countries in West Africa combined that were then struggling with Ebola. It has much more traffic in and out. It's a chaotic city. And initially, the person in charge was not well organized. With strategic calls, we had a very talented manager who had led the polio elimination activities there, put in charge, and they snapped into place. And in just a question of days, they built a practical Ebola treatment unit in 10 days. It usually took months for that to happen. They went to the homes of 18,000 contacts and isolated and quarantined the people who needed that. And in just about 3-4 weeks, they ended the outbreak because of an organized system. And they repeated the whole thing in another city more than 300 miles away where 2 patients had fled to. It's not just in emergencies, though. We always have to get organized. But once you're organized, then you need to make sure you have the right approach. And I talk about simplicity. A lot of times we're way too complicated. If we don't simplify, we can't quickly scale up to reach entire populations. And then about communication. Communication is not about public health or about a program. It's part of the program, and you have to get it right. And finally, I talk about overcoming barriers, political, economic, social. And this goes back to understanding the causes of the Cassandra curse. One of them, as you know, is the prevention paradox, that things that help a lot of people a little bit make a bigger difference than things that help a few people a lot. Or vice versa, things that hurt a lot of people a little bit do a lot more harm than things that hurt a few people a lot. And what that means is that anytime we in public health try to get something done, we're helping a lot of people a little bit, but we don't have an organized group. We have concentrated people who oppose us, tobacco industry, for example, and diffuse benefits, which may be many years in the future.
Right.
But there's a way forward. Figure out who wins, who loses. Who are the advocates and champions and partners? What's the timing, and what are pragmatic ways to make a difference there? And with that, you can make a lot of progress even on tough issues, though it may take a long time.
I really appreciated the book for its candor, the stories that you tell, and also its underlying optimism, even at this moment. And I think, as people are listening to our discussion or picking up your book, they may ask, how is it possible to be optimistic about public health at this moment? What would you say?
Facts are stubborn things. The truth is on our side. Everybody's got to die, but people don't have to die early deaths that are preventable. People don't have to become disabled from things that we can prevent. People don't have to develop dementia and other conditions that we know how to prevent. I predict in this book, that the heart attacks and strokes that kill about 1 in every 3 people today will, if not within my lifetime, then definitely within my children's lifetime, be as rare as largely forgotten killers like trachoma and typhoid and tetanus are today. And to do that, we have a proven way forward, a proven approach, a proven formula. It can work for communities and it can work for individuals.
Dr. Tom Frieden, thank you so much and congratulations on this tremendous book.
Thank you, Josh.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.